Front Plank and Side Plank Progressions by Chris Hagan, Felicity Harris, and Katie Lamb. The primary muscles activated during a prone or side plank include the core musculature, as well as other muscles that help to stabilize the upper and lower extremities. These muscles include the transverse abdominis, internal obliques, external obliques, the rectus abdominis, latissimus dorsi, the pectoralis major, hamstrings, quadriceps, the iliopsoas, upper and lower trapezius, hip rotators, and the glutei. It was found that to increase spinal stability, it is important to improve the dynamic stability role of the segmental muscles as well as focusing on global musculature. It was also found that the internal obliques and transverse abdominis are the key deep abdominal muscles that are responsible for spinal stability during ADLs as well as during athletic competition. Co-contraction of core musculature, also known as abdominal bracing, was found to have a percentage EMG max activation of 15% in the rectus abdominis, 27% in the external obliques, 60% in the internal obliques, and 19% in the erector spinae musculature. This image shows the muscle activation during a prone plank. In addition to these muscles, we would also encourage the activation of the glutei. This image shows the primary muscles activated during a side plank. Plank exercises have been found to improve spinal instability as well as athletic performance. Trunk stabilization exercises have been found to increase force production in both upper and lower extremities. Plank exercises can also improve complaints of low back pain. You should not prescribe plank exercises in patients that have neck or back pain during the plank exercise, have shoulder joint inflammation or other joint issues, or have too weak of a core causing the spine to sag during the exercises. To perform a plank exercise, have the patient get into a push-up position and place their elbows and forearms onto the floor. Instruct them to engage their abdominals with a posterior pelvic tilt and draw their belly button in towards their spine. Encourage them to maintain a neutral spine throughout the exercise. Their body should be as straight as a plank of wood. Hold this position as prescribed. Use verbal cueing to engage both the glutes and abs for increased stability. You can also use tactile cueing by placing a foam roll on the back to reinforce a neutral spine position throughout the exercise. Once your patient has successfully maintained neutral spine throughout the plank exercise, you can ask them to raise one upper extremity at a time while maintaining the neutral position. Progress them to raising one lower extremity at a time, and then eventually progress them to raising the opposite upper extremity and lower extremity simultaneously, all while maintaining a neutral spine. Next, you will see a demonstration of the prone plank progression.
Hello, I'm Felicity Harris. I'll be your physical therapist today. So what we're going to do is an exercise to address the lumbar instability that you have. And so this exercise is called the plank prone position, and it's going to activate a lot of the anterior core musculature and all the muscles that attach to your pelvis, such as your rectus abdominals and your internal and external obliques. And it will also activate the anterior muscles as well. So if you could, you can take your shirt off for me just so I'll be able to see what's going on a little better. So with this exercise, you can expect to just feel the anterior core muscles working. So you might feel a little burn, but that's great. That means you're using the muscles you're supposed to. Okay, and then with this exercise, we expect for you to be able to strengthen and increase the endurance of those muscles that stabilize your lumbar spine in order to address the pain that you've been having. So if you could, we're assuming that you've learned the neutral position, lumbar and just neutral spine. So if you could get into a push-up position for me, and you'll actually go down onto your elbows. And so with this, we want to make sure that you're activating your glutes, you're maintaining a posterior pelvic tilt, so that just means you're tucking your butt under, you're drawing in your abs, And then you're also just making sure you have your head in a nice alignment, neutral. And you will hold this for about 20 seconds. I'm using this just so you can feel if you're in a straight line, which is great. Good, you can relax. So you would hold that exercise for about 20 seconds, or just as long as you can maintain the neutral spine. So if you start to sag, then that means you've done it long enough. Okay, great. So the next exercise is a progression of it. And so what we're going to do is just, you're going to take one upper extremity, you're going to lift it out to the front, one arm out to the front, and then you're going to alternate, lift the next arm out to the front.
Okay.
And this is just challenging your balance and your proprioception a little bit more than just spinning on your elbows.
All right.
So same things, drawing your abdomen, posterior tilt, so tuck your butt under. Head in neutral alignment, spine in neutral alignment, and you can alternate your arm. Good. And you can do this for 20 seconds or for as long as you can maintain if you can't get up to 20. Good. You can relax. Good job. The next progression, we're going to do the same thing, but we're going to use your legs this time. So you're going to remember all the things I told you, and you're just going to extend one leg at a time back.
Okay.
And again, you would maintain this for 20 seconds. Drawing in your abdomen, keeping a nice neutral neck position, spine, butt tucked under, alternate your legs. Great. You hold this for about 20 seconds. Great. You can come down. Good. This last progression is going to challenge you just a little bit more, and it'll just recruit your muscles that much more and work on the balance and proprioception. So what you're going to do, same position. This time you're going to alternate lifting one arm and one leg together at the same time. All right, good. Good. Nice neutral spine and head position. Hips tucked under, abs strong in. You can alternate, good. And as best as you can, you try to stay everything straight. Good. As you can see, this is challenging. Good. You can relax.
For the side plank progression, begin the patient in side lying with their supporting shoulder in 90 degrees abduction, 90 degrees of elbow flexion, and their knees slightly bent. Leaving their hips on the table, have the patient activate their internal and external obliques while keeping a neutral spine. Once the patient is able to hold that position, instruct them to lift their hips off of the table while keeping still a neutral spine. For the third progression, fully extend the supporting arm as well as the other upper extremity. The patient should have full knee extension, hips off of the table, and still keep a neutral spine. Remind the patient to activate their gluteal muscles as well. The fourth progression, the patient returns the supporting forearm to 90 degrees of shoulder abduction and 90 degrees elbow flexion. Keeping the knees fully extended and hips off the table, have them lift the top leg into hip abduction. For the final progression, keep the shoulder, elbow, and knees in the same position as 4. Return the top leg resting upon the other leg, and perform an inward trunk rotation, keeping everything else stabilized. We will next demonstrate the 5 side plank progressions.
Okay, so now we're going to do the side plank progression, which basically activates the same muscles as the prone plank progression that we just did, except it has a little bit more demand on your lateral muscles, such as the internal and external obliques. And so with this exercise, you will make sure you do both sides. So the first progression we're going to start with, you can remove your shirt just so you can see. The first progression we're going to start with is the side plank. You can have your head facing that way. Good. And so with this first one, you'll still have your hips on. You'll have your hips on the mat, knees bent just how you have them, elbow bent, and you are pushing up a little bit, but hips are still on the mat table. Great. The next one, you're going to lift your hips off of the table. Good. And just as with the last plank progression, you're drawing in your abdomen, nice neutral spine, neutral position of the head. Great. With all of these, you would hold for 20 seconds. Great. You can relax. The next one we're going to do is you'll have your arm extended, your legs straight out, and this arm as well will be straight up hips off of the mat. Great. See how you have a nice straight line, you're maintaining good hip position, tucked in posterior, your pelvis, nice line of the spine. Good, you can relax. And again, you will maintain for 20 seconds. The next one we're gonna do is you'll be back on your elbow, but this time you'll have one leg raised up. So this will just give more activation to those gluteal muscles. Great, just like that. And maintain that for 20 seconds, remembering nice straight line, neutral posture. Good. You can relax. And the last one we will do is the same position here, except you're going to add an inward roll. So arm position is the same, nice straight legs, abdominals nice and tight, pelvis tucked under. And you're just going to roll a little bit forward this time. Good, perfect. And you would maintain this for 20 seconds. Good, you can relax.
Planks have been found to be effective in that they keep the patient in a functional position. This functional position is with the spine in neutral with isometric trunk muscle contractions. In addition, abdominals primarily work to stop, not start, motion in day-to-day activities. Plank exercises emphasize this action more so than sit-ups. Planks also help to maintain core muscle stability, and you can easily progress this to upper and lower extremity activation with the plank progressions. There is a clear relationship between trunk muscle activity and lower extremity movement. It has been found that decreased core stability may lead to injury, and appropriate training, such as with plank exercises, can help prevent this injury. Plank exercises target trunk musculature and core stability, and have been shown to help relieve low back pain, as well as be beneficial in treating musculoskeletal symptoms such as patellofemoral syndrome or lower extremity injury. Increased endurance of core musculature can help facilitate improvements in stability, posture, balance, and proprioception. Plank exercises help to activate the muscles that act as spinal stabilizers, such as the rectus abdominis and transverse abdominis. They also require a neutral spine position needed for proper posture. They incorporate different variations of plank exercises, such as lifting extremities or using a stability ball to challenge balance in order to remain upright against gravity. And finally, to have improved proprioception, it is necessary to maintain neutral spine, which is highly emphasized throughout the plank exercises. When prescribing plank exercises to your patient, we recommend starting at 3 times per week, preferably on alternating days, in order to give the muscles rest that they need. You need to be able to maintain a neutral spine throughout the entire plank hold. Progress to a more challenging variation of the plank when you can maintain the proper positioning for over 30 seconds without fatigue. Start out completing 3 sets of 20-second holds, all while maintaining a neutral spine. If initially you cannot hold for 20 seconds, hold the position for as long as you can and gradually increase the amount of time as you can tolerate it. By following this recommended prescription of plank exercises, you will increase the endurance of the core musculature and therefore improve spinal stability throughout the lumbar spine.